I was supposed to go grocery shopping today, but my social phobia got in the way.
I never made it to work today because it took me so long to finish the dishes.
I had school in the morning, but I couldn't get out of bed.
There are no limits in age in which mental health can be affected. It can affect the young to the elderly. Depression, mood disorders, schizophrenia, anxiety, eating disorders, substance abuse, bipolar disorder, PTSD, dissociative identity disorder, phobias, and OCD are all examples of diagnosis in mental health that occupational therapy can help with.
Occupational therapy practitioners collaborate with people in a manner that helps to foster hope, motivation, and empowerment, as well as system change. Educated in the scientific understanding of neurophysiology, psychosocial development, activity and environmental analysis, and group dynamics, occupational therapy practitioners work to empower each individual to fully participate and be successful and satisfied in his or her self-selected occupations. Occupational therapy practitioners assume a variety of roles such as direct care therapists, consultants, academic educators, managers, and administrators. They may also work in state and national mental health organizations to help assist in local, state, and national transformation efforts. Occupational therapy practitioners provide mental health services in the following settings: acute and long-term care facilities, private and public hospitals, forensic and juvenile justice centers, residential and day programs, skilled facilities, community-based mental health centers, schools, military installations, employment programs, private practice, and out clinics.
Having a mental health illness can get in the way of one's occupations, which disrupts their participation within their context. These contexts include cultural, personal, temporal, and virtual. Cultural contexts include your customs, beliefs, activity patterns, behavior standards, and expectations accepted by society. A mental illness can hinder these cultural aspects. For example, one may not be able to go to church because they are too depressed, or they may not be able to celebrate their holidays such as Christmas or Thanksgiving because they are too afraid to leave their house due to anxiety. Personal contexts include things like age, gender, socioeconomic status, and educational status. Someone who is struggling with a mental illness such as schizophrenia may be unable to keep a job, which affects their occupation of work, or also may not be able to attend school, which affects their occupation of education. Temporal context includes stages of life, time of day or year, duration, rhythm of activity, or history. Illnesses such as OCD or PTSD may inhibit the ability to realize what day of the week it is or what month it is. Lastly, virtual context includes environment in which communication occurs, such as by telephone or computer. This context is the absence of physical contact. A mental illness such as depression may disrupt this context as one shuts out their phone or computer to avoid communication with their friends or family, which affects their occupation of social participation.
We envision that occupational therapy is a powerful, widely recognized, science-driven, and evidence-based profession with a globally connected and diverse workforce meeting society's occupational needs is a centennial vision for occupational therapy. It has been predicted that mental health illness, especially depression, will be the leading cause of disability in the 21st century and has been identified by the American Occupational Therapy Association to be a key practice area in order to support the centennial vision. They have placed a strong emphasis on the prevention of mental health for those that are at risk and treatment for those with a mental illness.
Thanks to my occupational therapist, I can now go into the grocery store.
Thanks to occupational therapy, I now don't have to worry about finishing my household chores before heading to work.
Thanks to occupational therapy, I now have the energy to get out of bed and go to school.